Hello, my name is Ava Price, and I am a nurse practitioner student. Today, I will be doing a cardiac and respiratory assessment. I will be doing it on my son Cameron. He's here to help me with this assessment. Are you okay with doing this assessment?
Yes.
All right, this should not take more than a few minutes. All right, so when I come in, I'm going to visually inspect his color. Color is true to ethnicity. Temperature is warm. There is no moisture. Texture is good. No edema. There's good turgor to the skin. There's no bruising. Also, there's a few acne scars. There's no lesions. Also, there is a few nevi. All right, so I'm going to have him turn slightly, and we'll do an inspection of his AP diameter. All right, and his AP diameter is 1 to 2. While I have him here, I'm going to be looking at his breathing, how much effort it's taken for him to breathe, the rate, the rhythm, is it symmetric? If he was coughing up anything, we would look at the sputum. We'll also look at signs of respiratory distress, and we would look at him, is he using his accessory muscles? Is he in a tripod position? We'll look at his nose, is there nasal flaring? Also, is the chest retracted? Is he tachypnic? Are there any signs of stenosis? These are signs of abnormal breathing. I don't see any signs of that. We're going to also look at obvious signs of deformity and symmetry. And we're going to palpate for symmetric expansion. So I'm going to have you turn just a little bit. I'm going to put my thumbs here and have him take a deep breath and then blow out. He is symmetric. We're going to palpate for tactile fremitus. And the way we're going to do that, each time I tap on him, he's going to say 99. And we'll do that between the intercostal spaces. And if I should hear it clearly, that is a positive sign for tactile fremitus. So have you turn. And I'm just gonna tap, say 99. 99 each time I tap.
99.
Okay, so the sounds are muffled. So he is negative for tactile fremitus. Also, I'm going to listen over his lung fields to see if they're clear. And we'll do that. We usually do 8 on the back and 6 on the front. And what we're listening to, tracheal sounds are heard in between the intercostal spaces. The bronchosvesicular sounds are heard in between the shoulder blades. And we're going to be listening for any crackles, rails, bronchi, or wheezing. So I'm going to go ahead and listen to him now. I'm going to have you stand just a little bit. That'll make it easier. Take a deep breath in and blow it out as I put the stethoscope across. Deep breath in and blow it out. Deep breath in, 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 and blow it out. Okay? Everything seems normal. So, also, we're going to test for egophony. So, I'm going to listen to his chest again, and I'm going to have him continue to say E. If I hear E, that's negative, but if I hear it as A, it is positive for egophony. So when I put the stethoscope on, you say E.
E. E. E. E. E. E. E. E. E. E.
Great. He's negative for egophony. And now I'm going to test for bronchophony, which he'll say 99. And if we hear it clearly, it's positive. If we hear it muffled, it's negative. So I'm going to have him do this for me. 99. 99. Okay. So it was muffled, so it was negative. Also, our next test is what's called a whisper pectriloquy. So what I'm going to have him do is whisper 1, 2, 3. And if it's positive, if the sounds continue to get louder. If it stays muffled, it's negative. There's no consolidation of air. So what I'm going to have him do, he'll say 1, 2, 3 as I go down. Just whisper 1, 2, 3. Whisper. 1, 2, 3. 1, 2, 3. 1, 2, 3. All right. So the sounds did not increase. They decreased as I went lower into the lungs. So that's a negative for whisper pectriloquy. Also now I'm going to percuss for the CVA tenderness. This will let us know if he has some type of kidney problem or kidney infection. And we'll go between the second rib. I'll put my 2 fingers there. Let me know if that hurts. Does that hurt? No. Great. So he's negative for the CVA tenderness. So next we'll inspect his anterior chest. I'm going to have you sit right here for me. Great. So again, we're going to inspect the skin color. His skin color is normal for his ethnicity. The temperature is warm. There's no moisture. The texture is smooth. There's no edema. The skin turgor is good. There's no bruising. There's no scars. There's a tattoo. There's no lesions. And there is a few nevi. So we'll do our obvious inspection, looking at his breathing, seeing if there's any abnormalities. Is it symmetric? Is there any retraction? Just looking for any abnormalities. His expansion, I'll do this. his expansion. Have you take a deep breath up and down. Okay, symmetric. He is symmetric. And also, we're going to palpate his chest again for tactile fremitus. So, as I go down your chest, you'll say 99, 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so he is negative for that. I didn't hear, I could hear muffled sounds. Okay, so now we're going to auscultate his lung fields on the anterior chest. And while I'm doing that, all right, lung sounds are clear. Gonna also auscultate his cardiac sounds. And we're gonna be doing that in 5 areas. We're gonna do, first we'll do the aortic, the pulmonic, Erb's point, tricuspid, mitral valve. So we'll first going to do that. So first we'll listen to the aortic, pulmonic, tricuspid, and then the mitral valve. I did that with the diaphragm. Now I'm going to turn it over to the bell and listen going back up. We will do the mitral valve, tricuspid, Erb's point, pulmonic, and then the aorta. Great. So when we listen, we're also going to identify and palpate the PMI. And then the way we identify that is we're going to go to the second 1-2 intercostal space, mid-clavicular, and then be right there. We're going to listen there. And we're going to listen for a full minute. Pulse rate is 72. All right, so now I'm going to have you lie down for me. Have you lie down the other way. Scoot down this way, Cameron, so you can be on the camera. All right, so I'm going to be looking at his breathing. Is there any problems with, is there any heaves, any lifts? There are not. It's normal breathing. I'm also gonna palpate for any thrills over the areas that I auscultated. So I'm gonna go aortic, pulmonic, Erb's point, tricuspid, and mitral valve. That's normal. And then I'm gonna also listen while he's laying down to see if there's any different sounds when he's laying down. So aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Great, and we'll do it going back up with the bell. All right, and next we're gonna assess his JVD. And what I'm gonna put him up with some pillows to about 30 degrees. And then I'm gonna look at his neck and just kind of measure off whether he has any jugular distension. There's no jugular distension. Measurements are less than 2 centimeters. And this is the end of my assessment. Thank you so much for participating.